Niosh Air Filtration Rating. Niosh Air Filtration Rating refers to the classification of filtration in the United States given by the National Institute for Occupational Safety and Health, Niosh, during the certification and approval process for respiratory protective devices established under Part 84 of Title 42 of the Code of Federal Regulations, 42 CFR 84. These respiratory protective devices include air-purifying respirators, APR, such as filtering facepiece respirators, dust masks, and chemical protective cartridges that have incorporated particulate filter elements. These classifications only refer to the filtration of particles/aerosols and do not refer to the air-purifying respirator's ability to remove chemical gases and vapors from air, which is regulated under 42 CFR 84 Subpart L. For more information, see cartridge, respirator. Niosh Classifications. Niosh has currently established 9 classifications of approved particulate filtering respirators based on a combination of the respirator series and efficiency level. The first part of the filters classification indicates the series using the letters N, R, or P to indicate the filter's resistance to filtration efficiency degradation when exposed to oil-based aerosols, for example, lubricants, cutting fluids, glycerin, etc. Definitions and intended use for each series is indicated below. The second value indicates the minimum efficiency level of the filter. When tested according to the protocol established by Niosh, each filter classification must demonstrate the minimum efficiency level indicated below. Since filters are tested against the most penetrating particle size of 0.3 m, an APR with a P100 classification would be at least 99.97% efficient at removing particles of this size. Particles with a size both less than and greater than 0.3 m are filtered at an efficiency greater than 99.97%. Although it is counterintuitive that particle sizes of less than 0.3 m are filtered with a greater efficiency, the forces which have the greatest impact on the effectiveness of filtration, aerosol impaction, interception, and diffusion, are weakest at this size for filters tested by Niosh. A filter's collection efficiency for particle sizes other than those for which it is least efficient is indicated by the filter's efficiency curve. Contrast with surgical mask. Surgical masks are primarily intended to protect the wearer from direct splashes and sprays of blood and bodily fluid, as well as the release of aerosols from the wearer that may adversely impact a patient or other individual. N95 filtering facepiece respirators cleared by the Food and Drug Administration for use as surgical masks, in addition to providing respiratory protection to the wearer, are known as surgical N95. Typical surgical masks do not provide the same level of filtration as a Niosh-approved respirator, as they are neither tight-fitting or capable of providing sufficient filtration over a wide range of particle sizes. The United States Centers for Disease Control and Prevention, CDC, recommends the use of surgical masks as part of standard precautions when conducting procedures that result in aerosol generation and the patient is not anticipated to be infected with a disease known to be transmitted by small aerosols. The CDC recommends the use of Niosh-certified respirators equivalent to N95 or greater to prevent the inhalation of infectious particles, for example Mycobacterium tuberculosis, avian influenza, severe acute respiratory syndrome, SARS, pandemic influenza, and Ebola.